उन्हें नहीं पता लग रहा होता कि हमें सब चल क्या रहा है, ठीक है. सो जिस तरह हमें बुखार हो जाता है, वी टेक ट्रीटमेंट फॉर इट. सो इफ सच कंडीशंस अकर, जो कि सिम्टम्स हैं, तो वी शुड कंसल्ट द डॉक्टर एंड टेक द मेडिकेशन. And unfortunately more women are affected by depression than the men, and depression can lead to suicide. There are effective treatment for mild, moderate and severe depression because there are different subtypes. In 2017 World Health Organization actually celebrated the whole week on it, for depression. And in India, depression is one of the leading causes for disability, and a massive 86 million people are affected by depression also. So it's very serious actually. So what is the difference? This is what I have explained before, that once we have the mood fluctuations, those mood fluctuations are not actually the depression. It should persist for 2 weeks at least, okay. And there are different types of depression. When I explored it, the unipolar depression, bipolar, psychotic, dysthymia, postpartum depression, among the populations, because I was working in Malaysia, and it was the University Saints Malaysia Hospital, in the psychiatric clinic. Most of the patients who are coming there, they have schizophrenia basically, but some of them which had depression. So in the depression category, 13 to 16% of them were actually unipolar depressed. So I took that sample for me, and I spent 6 months, and I managed to get at least 33 patients. Okay, so that data which I acquired from those sample is the EEG data, and there are more than 6,000 downloads of data worldwide now, because when I published that, I uploaded the data also, so I make it public as well. So that is also a contribution that we can do, okay, besides this. So from the medical point of view, the frontal part of the brain and the mid brain, which you can see over here. Okay. So these two areas are mainly affected. So this is proven from the medical point of view. But from the engineering point of view, how we can interpret it, because we put sensors. Okay, like Dr. Shah said that she is developing the sensors. So there are sensors which actually sense the electrical activity of the brain, because the electrical activity is always there. Even if we are sleeping, there are sleep studies, and there are electrical activity of the brain. Okay, so there are sensors, and there are locations that are standard locations, and those locations are actually titled by the frontal, temporal, occipital. So frontal F, temporal T, central C, occipital O. So these are all those actually the locations. For example, in frontal there are more than one sensors which we put, and those sensors are basically FP1, FP2, F3, F4. So these are all the locations. If we look at from the topographic point of view, these are the locations. Okay, so this area over here is the frontal part, this is the central, this is the temporal, this is occipital, this is parietal.
तो दिमाग के ऊपर इलेक्ट्रोड्स लगाते हैं ताकि इलेक्ट्रिकल एक्टिविटी को पिक कर सके कि दिमाग तेज चल रहा है या ठंडा चल रहा है, यही होगा.
Exactly. We can say कि एक person झूठ बोल रहा है कि नहीं बोल रहा. We can tell that as well. So you can see the studies on this lie detection with the EEG. असल में दिस इज द इनोवेशन की बात की आप लोगों ने. तो इनोवेशन यही है कि वी आर इम्प्रूविंग द प्रोसीजर्स. Okay, and yes, we appreciate the single innovative things which we are doing actually. So the challenge in depression is diagnosis, the early diagnosis, because it's a comorbid disease. Comorbid means that the symptoms overlap with schizophrenia, with bipolar. So how we know कि इसको by unipolar depression है. So अब 1 महीने के बाद पता लगता है, और फिर 1 महीने के बाद पता कहता है आपने दवाइयाँ तब्दील कर दी हैं, ये क्या किया आपने. तो द क्वालिटी ऑफ लाइफ जो है वो काफ़ी मिजरेबल हो जाती है इस सिचुएशन के अंदर. सो द कंट्रीब्यूशन फ्रॉम द इंजीनियरिंग पॉइंट ऑफ व्यू इज कि हम साइंटिफिक एविडेंस प्रोवाइड करें इन एडिशन टू द डॉक्टर्स असेसमेंट, ताकि डॉक्टर्स को पता लगे नहीं वाकई इसको यूनिपोलर डिप्रेशन है, ताकि शुरू से ही वो एग्जैक्टली. सो द दवाई का इफेक्ट ये है कि इफ वी परफॉर्म द राइट डायग्नोसिस we can go to the right disease also. Okay, so there are many studies on it और literature में. तो हमारा solution ये था कि the patient comes to the clinic and the doctor performs its own analysis along with the EEG. Okay, so we are not replacing the doctor because it cannot. And there is patient history, subjective experience of the doctor, and also the EEG, the measurement, and then the right medication can be decided based on that. So that is the innovation in the procedure. Okay, so this is one of the examples.
What's the follow up?
Uh,
What's all medication?
जी जी बिल्कुल बिल्कुल. Actually what we did, टाइम जीरो पे जब पेशेंट आ जाता है, ठीक है, सो देर विल बी 4 weeks बिफोर द फर्स्ट असेसमेंट. SSRI जो हैं वो 2 weeks की भी हमें देती हैं ऑप्शन. तो फिर हमने उनको वापस भी देखा कि वो रिस्पॉन्डर्स हैं कि नॉन रिस्पॉन्डर्स हैं, बिकॉज EEG के थ्रू. Yes, we perform the longitudinal study where we have the data of week 0, week 1, week 2, week 3, week 4. So I have that data. If some of the students they are interested, they can reach me and then he or she can work on it also. हाँ, यहाँ पे भी हो सकता है, बिल्कुल बिल्कुल यहाँ पे भी हो सकता है. Yeah. Thank you, sir. Okay, so